Hello everyone. Welcome to this presentation on how to write a research abstract for the International Conference on Family Planning. My name is Linnea Zimmerman, and I'm a co-chair of the Scientific Subcommittee for the International Conference on Family Planning. This content was developed by the Scientific Subcommittee of the conference and is part of a series that includes guidance on how to write an abstract for submission to the research track, the program implementation track, or the advocacy and accountability track. Each of the presentations is available in both English and French. Today I will share with you the key elements and important considerations that will help you prepare your abstract for the conference and increase your chances of being accepted for presentation. You may also find that the tips shared in this presentation are useful for other scientific writing and publications. In this presentation, we will go through why you should present at ICFP, and the main sections of the research abstract for ICFP, namely the title, significance and background, main question and hypotheses, methodology, results and key findings, and knowledge contribution. First, why present your research at ICFP? There are many reasons to present at ICFP. Most importantly, you are contributing to the field of family planning with new knowledge. It is also an opportunity for you to learn about the most recent advancements in the field of family planning, raise awareness about your research, and explore opportunities for research collaboration. ICFP is an opportunity to develop new skills and practices through interactions with other researchers, advocates, service providers, program implementers, and policymakers. And finally, your presentation at ICFP contributes to your professional development. As you work on your abstract, keep in mind the purpose of a research abstract. There are multiple purposes to a research abstract. One purpose is, of course, to demonstrate to reviewers the relevance of your research and be accepted to the conference. But there are other purposes too. If you are accepted, your abstract will provide a brief summary of your research that attendees can review and use to decide whether to attend your session. So it's important that it conveys the importance and findings within your research. Additionally, abstracts from conferences are frequently posted online, which means that other researchers may review them even after the conference. So the research abstract must accurately and succinctly summarize the research questions, the methodology, key findings, and knowledge contribution for other researchers to review. To meet these objectives, your abstract should be clear and succinct, accurate, and complete. Remember, an abstract is a package and as a whole should be able to tell your story. Avoid jargon and confusing language and make sure your results are correct. Do not leave any section blank or incomplete and respect the word count of each section of the abstract. The system will cut off additional words, so if you go over the word limit, reviewers will not see what you write. And if you leave an entire section blank, your abstract will not be competitive. Let's take a few minutes and go through each section of a research abstract. The title. Why is a title important? It's the first thing that people will see. If the title of your abstract isn't relevant or interesting, people won't read the rest of your abstract. So spend time on the title. Avoid long titles, limit yourself to 10 to 12 words. Whenever possible, use descriptive terms and phrases that accurately capture the content and, in particular, include the type of study. There are 4 important aspects for a good title. First, use a few words to condense the content of the abstract. Don't try to summarize the whole abstract in your title. 2, include the type of study. For example, randomized control trial, cross-sectional study, or cohort. 3, capture the attention of the reader. And 4, differentiate the abstract from other articles on the same subject. What is it about your research that is new or different than other people's? As you may imagine, we receive many very good titles and a good number of titles that are not so good. So below are a few examples from the Kigali ICFP that we thought were good examples to share. First, do maternal care contacts improve postpartum family planning? Evidence from a longitudinal cohort study in SNNPR, Ethiopia. 2, Not Without Us, a tool for responding to youth needs in costed implementation plans. 3, handheld device for removing a one-rod subdermal contraceptive implant. results of a pilot study and future work. And 4, a characterization of male partners of women using Tier 1, 2, and 3 effective contraceptive methods in Western Kenya. Now let's discuss what should be in the significance and background section. Remember, stick to the word limit in each section. In this case, that is no more than 200 words. In this section of the abstract, you should make sure you clearly describe why your study was necessary. What is known about the research, but equally important, what gaps remain in our knowledge? What are the limitations of previous research that are so important that more research is necessary? How does your study fill those gaps? It is a fine line to balance, but you want to describe why your question is important by summarizing previous research that highlights its importance, but also explain why that previous research is not sufficient. This is a chance to iterate the importance of your research to the field of family planning. A few do's and don'ts. Do identify why your research question is important and provide relevant and specific context. To the extent possible, try to identify research that has been done in the same setting, or at least a similar setting. For example, if you are doing research on adolescent family planning in Uganda, it's generally not helpful to cite research on adolescents from the US. The contexts are just too different. Use research from other similar settings. The only time that you may want to cite research from very different contexts is if you are demonstrating that your question has not been adequately studied in your context. For example, research from high-income settings shows that there is high demand for IVF, but this has not been adequately studied in low-income settings. Do not make the common mistake of summarizing what is known about the issue without identifying what's not known, or waste space on generic background information. You don't need to summarize the entire study setting in the abstract. Finally, always be specific to the context and research question. For example, if your question is about adolescents, don't waste space talking about adults. Below is an example from the 2018 ICFP. I will pause for a moment so that you can quickly review, and then we will discuss some key components. Now let's discuss how this section fulfills the criteria that were described in previous slides. In the first 3 sentences in blue, the authors describe why the question is important. They establish that postpartum family planning is an important intervention and that the majority of postpartum women do not use contraception. This is what is known already. Integration into services is recommended, but effectiveness is still not well established. This is what is not known and why the research is important. In the highlighted sentence, the author provides relevant information about the health program within Ethiopia that will be assessed in the research. This is contextual information specific to the research question. Here, the highlighted purple sentences revisit what is not known about the research question. Here, the authors lay out the gaps in knowledge that exist because of research limitations and further justify why their study is necessary. These include gaps in other data collection efforts, such as not measuring specific components of care and bias resulting from retrospective reporting. The authors use the last sentence to elaborate on the added value of the study. Think about, how does your study address the limitations that you highlighted? What does it add? Now let's look at the third main component of your abstract, the main question or hypothesis, which should not be longer than 100 words. In this short section, you should address the questions that your study is answering and what aims or hypotheses your study tests. Not every study will have a specific hypothesis. For example, studies that are exploratory or attempting to identify a range of factors associated with contraceptive use may not have a specific hypothesis. And qualitative research generally does not have testable hypotheses. But every abstract must have a clear research question that is being answered. If your research question is not clear, then reviewers cannot evaluate whether your methods are appropriate or your findings are relevant. If you are including a hypothesis, make sure your hypothesis is specific, clear, and testable. You may consider the PCOT format. P is for population sample that participated in the study. Who are you using to test your hypothesis? I is for the intervention, if one was used. C is for the comparison group that you plan to use as a reference. Who are you comparing to? O is for the outcome of interest. Be specific about what exactly is being tested. T is for time or duration of the data collection. I will give you a few seconds to read through this example from an abstract accepted at 2018 ICFP. As color-coded here, you may see how the authors made sure to include the population and the comparison groups in blue, the outcome of interest in purple, and the time frame in green. In this case, the intervention that was being assessed was contact with skilled maternity care providers. This was not actually an intervention being provided by the project, but still serves as the primary variable of interest. Now that you've clearly established your research question, let's spend some time looking at what to cover in the methodology section. This section also has a word limit of 200 words. The methodology section focuses on tools and techniques used for the research. It should cover location, where was the study conducted? Note the geographic location and anything that may be highly relevant to the research question. For example, if you are studying family planning among pastoralist populations, you may want to note that the location has a high pastoralist population, so people know why you chose this location. But don't spend too many words on describing the study setting. For example, you don't usually need to describe the overall population of the country, the age distribution, the trends in TFR over time, etc. Study design. What design was used in gathering information? Was it a cross-sectional design, randomized clinical trial, longitudinal cohort, etc.? Data source. What were the collection procedures? Is the data primary or secondary data? Time frame. When was the study carried out? Sample and sample size. How many people were in the study? How were they identified? What were lost to follow-up rates if it was longitudinal? Analytical approach. How did you define your outcome, and what were the analysis procedures that you used? For qualitative research, what theories did you apply and coding practices? For quantitative, what statistical models did you use? Keep in mind that this section helps reviewers assess whether the methods you applied were appropriate for your research question. So be specific, but also don't be overly detailed. Ask yourself, is the information that you provided necessary? Do reviewers need to know it to understand the research? Or is it detail that does not change how someone would understand and interpret your results? Is it something that is nice to know? Prioritize including information that is needed. I will give you a few seconds to read through this example from the 2018 ICFP and reflect on whether this section covers the elements that we just discussed. As highlighted, the authors addressed all of the components outlined above. They gave a very brief description of the location and time frame in blue. The sample size, that is the number of people in the study, is described in green. The study design, including how women were sampled and the data source that was used, is in purple. The analytic approach is in orange. And here the authors explain multiple steps that were taken in their analysis procedure and specify the final outcome variable they are assessing, contraceptive uptake, after accounting for potential confounders. Now let's look at the results key findings section. This section should be no longer than 250 words. ICFP accepts abstracts with preliminary or final results. We will talk a little bit more about that difference soon, but in either case, you should make sure that you answer the main research question or questions in this section. Describe the relevant results from the data analysis while making sure that each of your research questions or hypotheses are addressed. If you don't describe the results of one of your hypotheses, reviewers will wonder why. Also remember the audience that this abstract will be presented to. Experts in family planning research are reviewing your abstract, so make sure you are emphasizing what is important from your research. Be specific and as clear as possible. Report both positive and negative findings when relevant. Don't be afraid to present null findings. Start the results section with brief and important descriptive results before analytical results. Consider reporting your results in parallel with your methodology. That is, if you conducted analysis in multiple steps, for example, descriptive analyses, then bivariate regressions, then multivariable regressions, present your results in that order. For quantitative research abstracts, report associations with confidence intervals or p-values. Confidence intervals are generally preferred, but can take up more space. For qualitative research abstracts, make sure your results are rich with depth, detail, and nuance, and clearly tied to the methodology used to reach them. You don't need to include specific quotes here, but instead highlight the summary and main themes. And for both kinds of research, make sure you are addressing your research question and, if applicable, hypothesis. As mentioned earlier, your results do not have to be final to be submitted. However, they should cover the key results related to your research question. Descriptive statistics and any exploratory analyses that give reviewers a sense of what your findings are may be helpful to include. You should also be comfortable presenting results even if they are not what you expected. This includes results where there were no statistically significant relationships if this is of central interest to the research question. Don't hide results if they are central to your research question. I will give you a few seconds to read through this example from the 2018 ICFP and reflect on how this example covers the elements that we just discussed. You can see that the author started with descriptive statistics in blue and findings that were relevant to the research question. In green, the authors summarized their findings before following them up with the specific statistics in orange. The authors do not include the results of the bivariate analyses here, but instead they focus on the adjusted results that are directly relevant to the research question. Note that they include both significant and non-significant results in purple. Finally, let's discuss the last part of the abstract, the knowledge contribution section. This should be no longer than 250 words. In this section, you should cover the most important key takeaways or lessons from your research in a few precisely worded sentences. The 3 essential questions to answer are: 1. Message. How do the findings address the problem or gap that you outlined in the background section? 2. Importance. What are the implications for the field? What does this mean for our general understanding of the research question? And 3, perspective. What are the recommendations and implications for future studies, programs, or interventions? Avoid the common mistake of making conclusions that are not supported by the data. Base your conclusions on what you found, not what you thought you would find or what you wanted to find. Allow space to mention important or unexpected findings and iterate on the implications of your findings for future family planning research, program, services, and policy. Remember that a wide range of people attend ICFP. Translating your research findings into policy and program recommendations is critically important. Again, I will give you a few seconds to read through this example from the 2018 ICFP and reflect on how this example covers the elements that we just discussed. Here the authors highlight some important takeaways. First, in blue, the authors highlight a descriptive finding that is relevant to policy and program implementers. In green, the authors identify a gap in service provision that is relevant for policymakers in Ethiopia. In purple, they highlight next steps that are needed for research and provide specific recommendations to programs. Before we end with frequently asked questions, it's important to briefly discuss the important issue of research misconduct. It may be a surprise to many of you, but we have had a few incidences where applicants to ICFP were disqualified because of misconduct. Good research ethics is the core of scientific integrity. Any sign of research misconduct is taken seriously during abstract review. Citations do not need to be included in the abstract submission, but if language is clearly copied from other sources, it provides immediate grounds for disqualification. It is mandatory for any abstract submitter to avoid any form of fabrication, falsification, or plagiarism. We have provided here a link to the Research Ethics Policy for the Johns Hopkins School of Public Health. These guidelines apply to all abstracts submitted to ICFP. We will end now with a few frequently asked questions. Probably the most common question, which abstracts are likely to be submitted to ICFP? Unfortunately, this question is not as simple as it sounds. Your abstract is more likely to be accepted if it strictly follows the guidelines and word count, but ultimately, reviewers will judge the scientific integrity and contribution of your work. Abstracts that skip sections or don't provide sufficient information are much less likely to be accepted. The Abstract Selection Committee tries to prioritize abstracts presenting new knowledge or evidence. Findings should be supported by the data, and a clear analysis methodology should be presented, irrespective of the language in which the abstract is written. Abstracts in English or French language are treated equally. Ensure clarity of the language used in the abstract, and review your abstracts to make sure there are no typos or grammatical errors. It is okay to have someone review your abstract for English or French language editing. Another very common question we receive is, why does ICFP have 1,000-word abstracts while other conferences often have abstracts that are 300 to 350 words? ICFP is unique in this way. Our main goal is to allow people to share new knowledge to inform practice. ICFP allows up to 1,000 words for individual abstracts and 400 words for abstracts submitted as part of a preformed panel. We do this to provide sufficient detail to allow the scientific committee to appropriately review the abstract and make a fair decision. It allows abstract authors to clearly clarify the research question and context and explain the methodology and results in detail. There are many do's and don'ts to having a successful abstract. In the US, we say, don't play baseball at a football game. What we mean is, this is a conference on family planning. If your topic isn't really related to family planning, it won't be accepted. Keep in mind the rule of 3. Simple, clear, comprehensible. Avoid very long sentences and dense paragraphs. Do not use any unusual terms or acronyms without defining them. Consider having your abstract reviewed by a native speaker of the language of your abstract before submission. Finally, for quantitative abstracts, be consistent when you include confidence intervals or p-values, and use the same number of decimal points throughout. Although it is common, try to avoid using passive voice. Consider using the present tense to describe the problem addressed by your abstract and implications for your research findings, but use the past tense when describing the methods used, the results found, and the study limitations and strengths. Remember, never start a sentence with a number. Although these are all small tips, they can help your abstract stand out. Remember, the abstract is about what you did, how you did it, what you found, what you learned, and why anyone should care. Don't try to summarize all content of the paper, just include what is necessary. I am sure that you already know of many resources for writing an abstract, but here are a few that you may find useful if you would like to read more on what we discussed today. Thank you for your time.